There's a nursing home crisis in our community, and it is severely limiting families looking for help.
That's the place they present it. And I read the reviews and I said, oh my God, I said, absolutely not.
There are not enough available nursing home beds for those who need them, and it's backing up our local hospitals and in our entire healthcare system. We've reported on this problem before, but tonight we show you just how dire the situation is through the eyes of a Greece woman who is running out of time.
Back in November, Cindy Bergio's husband Paul wasn't feeling well, so the Greece couple made a trip to Rochester General.
We took him into emergency. He was going into kidney failure.
He was admitted to the ICU. It was touch and go for weeks, but he was stabilized. Cindy says initially he was getting physical and occupational therapy, but one day when she arrived for her visit,
they informed us that we had to gown up and put gloves on. And I said, why? And they said, well, they had an outbreak of Candida and the step-down unit.
Candida auris is a highly contagious, multi-drug resistant infection. To stop the spread in a hospital setting, patients are typically isolated.
They sent him to the 5th floor. And I kept telling them, please, you got to get him up. We need him to at least walk to the bathroom so he could go in there, empty his own, colostomy bag. And he's got to keep his hands moving, this and that. Never got him up.
So now, almost 7 months later, Paul is in rough shape.
Never dreamed that this would take place. Never dreamed that my husband will never walk again.
But the hospital says he no longer needs acute care.
They said, let's face it, he's not rehabable. So now you got to look at a nursing home.
The social workers found him a bed, but it's at one of the lowest rated nursing homes in the entire region.
That's the place they present it. And I read the reviews and I said, oh my God, I said, absolutely not. And she said, well, you can't believe everything you read.
But CMS data shows it has just 1 star, and the state health department has cited it 94 times in the last 5 years for health and safety violations. So Cindy refused it. Then she got another letter from the hospital
telling me that I had to get an attorney by Sunday because they were going to start eviction notice, and I would be responsible for all their costs.
We know hospitals need to make room for those who need hospital-level care. We've reported on other families who've had to travel hours away for visits after their loved ones were sent to facilities out of town. But in this case, Cindy feels like the hospital-acquired infection led to isolation that made Paul's situation much worse than it would have been. She even showed me this email from an RGH social worker that reads, quote, referrals have been sent to skilled nursing facilities within both Monroe and surrounding counties. Despite these efforts, the primary barrier continues to be the patient's Candida auris status.
If they can't find him a place suitable, then they should keep him here until one of their affiliate places opens up and gets him a bed.
Jennifer Lukey, News 10 NBC.
An RRH spokesperson says nearly 1 in 5 of its inpatient beds are occupied by people who don't actually require hospital care, but are awaiting placement in the community. There is the option of home care, but Paul is on dialysis, not able to walk, and requires a lift. So that would be challenging for Cindy. RGH says it's committed to supporting a safe transition and is still looking for another placement for the family.